Here at the 2010 ONS conference in San Diego, we're delighted to have with us Dr. Martha Polovich. How does that title doctor sound? I know you just acquired it.
Well, I've been working hard for it for a while, so you don't have to call me doctor.
Great feeling though, huh? Great accomplishment?
It is. It's quite an accomplishment. It took me about 4.5 years, but I worked with some wonderful people and I learned a lot, and it's a good thing.
You did a very interesting study for your dissertation. Can you talk about it?
I'm happy to. I've always been interested in hazardous drug safe handling and nurses' exposure, and many of the hazardous drugs are chemotherapy agents. So oncology nurses are at risk for exposure to these agents in their everyday work. And it's always been interesting why, when we have precautions that are available that will minimize exposure, why would nurses choose not to use those precautions in their practice? And so my study was to measure factors that influence nurses' use of hazardous drug safe handling precautions. And so my theoretical model was that individual characteristics as well as characteristics of the workplace where the nurses are employed in handling chemotherapy would affect whether nurses use precautions or not. And so that's what I measured, were individual characteristics such as nurse age and education level, self-efficacy, which is their confidence in their ability to use the precautions, their perceived risk, whether they perceive that there's a risk of harm from exposure, and then barriers that would interfere with their ability to use the precautions. So those were the individual factors.
What are the biggest barriers here that oncology nurses are facing?
Well, based on the results of my study, the availability of personal protective equipment is the biggest barrier. If you don't have gowns available to you, then you're unlikely to use them because you don't have a choice. Other barriers include my coworkers don't use precautions and therefore I might not. And then other barriers such as the cost or the perceived cost of the personal protective equipment. And so I had a list of 13 barriers that we evaluated in the study, and they turned out to be the biggest impediment. The higher the barriers, the lower the use of precautions by the nurses.
Is there somewhere that people could see this study, the results of it?
Well, currently at the conference, the results of my study are displayed in the poster session, in the research poster session. So my results are there in the poster, and I'm hoping to publish the results of the study. That article's not finished yet, but hopefully will be published soon.
What exactly do you mean by workplace safety climate, and how does it affect nurses?
Well, workplace safety climate is the perceptions of employees about their employer's commitment to providing a safe environment for them. And there are many factors that are involved in that workplace safety climate. Are there policies about safe handling? Is there an expectation that the nurses will follow the policies? Is the workplace neat, clean, orderly? Do the supervisors communicate with the personnel about safety? Those are all factors that influence the climate of safety. In other words, is there encouragement for the use of safe handling precautions? And it turns out in the results of my study that right behind barriers, the higher the workplace safety climate, or the better the workplace safety climate, the more likely nurses were to use the precautions to protect themselves when they handled chemotherapy.
So basically, Marty, what you're saying is if nurses are given the tools that they need, they'll use them.
In general, that's the case. And if there's encouragement in the workplace to use the precautions, they're more likely to be used. And one other interesting finding in my study was as the number of patients per day increased, precaution use decreased. So nurse-patient ratio also has an impact on the use of precautions.
Thanks for being with us, Dr. Martha Polovich, the goddess of safety, joining us from ONS 2010 here on Oncology.TV.